Hi, I'm Wayne Tormala, Bureau Chief at the Arizona Department of Health Services for Tobacco and Chronic Disease. I've been on the show a couple times, and you've probably heard me on the air talking about my recent diagnosis of prostate cancer. We chose to go public with this because too often men sort of lurk in the shadows. They respond to myths, and they're kind of afraid to get tested, and ultimately they run the risk of getting cancer detection at a late stage when it's much more complicated to treat. So we're here to talk about what can you do to face up to these fears? What can you do to really demythify your approach to looking at your health issues, in particular with prostate cancer? I have with me here two very special guests, Dr. Thomas Canty, radiation oncologist at the Arizona Prostate Cancer Center, and my personal physician, I might add, and Dr. Eric Alexander, urologist with the Scottsdale Center for Urology. So thank you, gentlemen, for joining us.
Thank you for having us.
Thank you. So now I've faced my prostate cancer, but you guys face this day in and day out. You see a wide range of men and how they address their diseases. And what would be if your number one bit of advice for a man out there in the audience who's thinking, well, I'm over 40, I should probably start looking at this, but I don't know if I really want to deal with it. They might not even be that sophisticated in their rationale. They just know they're kind of staying away. What do you tell them?
Well, many men in their 40s still have yet to really discover what a family physician is. So best advice would be, hey, get a family physician, go in for a complete evaluation and physical examination. Part of that typically is blood work, and he should speak with the family doctor. Hey, I'm concerned about prostate cancer, other health issues. What do you think about screening? Basically have dialogue, discuss the issues. If it seems appropriate at that age to get a PSA level done and a rectal exam done, that should be done. If there's no family history, no complicating issues, you may choose to wait longer. But usually knowledge is power, and the more information available, including some simple blood tests and examination, probably the better off that patient will be.
Great. Dr. Alexander?
Yeah, and one thing I would say that's sort of odd about prostate cancer is men cannot rely on their body to tell them that there's a problem. And therefore, it's imperative that men get screened, whether that be 40 or 45. You can talk to either your urologist about that or your family practitioner. I agree that knowledge is power, and to get a baseline PSA at 40 is very reasonable, because again, if guys believe that they can wait for a symptom, by the time they get symptoms, it's too late. And that's the critical point that I would like to put out there. Know your score, know your PSA, and undergo a digital rectal exam. And that's how we find prostate cancer, because the key is to find it early.
Right. Now, could you name a few symptoms? Because there are probably men out there who haven't seen a physician. They might be experiencing symptoms. I know I've talked to men who have ignored symptoms for a while. It's amazing what they put up with to avoid going to a physician. But what are some symptoms?
I think symptoms of advanced prostate cancer can be bone pain, or also if there's fairly advanced cancer, there can be urgency, frequency, pelvic pain. Typically, those types of symptoms, urinary symptoms, are typically caused by benign enlargement of the prostate. Symptoms from prostate cancer typically don't arise until the cancer is quite advanced. And that's why, again, I think the key to the pledge is know the score, have the exam, because that's what's going to dictate the need for looking into it in more detail.
And not all symptoms mean you have prostate cancer.
Correct.
That's true.
What are some of the other, if I'm out there experiencing symptoms, rather than panic now because I think, by God, I've got prostate cancer, what are some other options that might be going on in my body?
As Dr. Alexander said, there could be benign enlargement of the prostate causing urinary symptoms. There could be sexual troubles, trouble with erections, and that doesn't necessarily mean prostate cancer. It probably means factor of aging or other disease that should be checked into, medications that may be taken. But the thing is to get checked, get tested, especially if there are symptoms. Don't put your head in the sand. Go to your doctor and get evaluated.
Right. And let's talk about options for treatment, because a lot of men don't realize there are a lot of options. We know that the science has moved rather rapidly on this. I think my specific treatment I'm getting with Dr. Canty here, is my understanding, has only been out there for a couple of years itself. And so if I find out I've had continued tests, I have a high PSA, I get a biopsy, now I've got a diagnosis of prostate cancer, what are my options?
One option that should be done is you need to speak to different specialists. Obviously, urologist was the one who probably did the biopsy. You'll be speaking to urologists about surgical techniques, cryosurgery, even surveillance, watching the cancer. If it's not a fast-moving cancer, you should see a radiation oncology doctor to get ideas about different types of radiation therapy treatments, different options available. And even go back to your family doctor. Your family doctor can have input. He knows your medical condition, health history, everything better than any of us, and he can even add some input and advice on what to do. So you need to gain knowledge, seek out different specialists, and be evaluated, and be ready to ask questions, and be ready to get some good information. And I know, as what has been said previously, if you don't feel you are getting good information from the physicians you're seeing, go on and see somebody else.
Right. And the role of people in your life, like for example, I've gone through every step of this with my urologist, even before the biopsy with my wife in the room. It's very important to me. And I knew that we were making decisions together, because the prostate cancer just isn't just affecting me, it's infecting anybody around me. The role of support people
is critical.
Yes.
And you know, when I sit down and discuss options with the patient, it really is critical to have the other family members there, because it's a very complicated process to go through the options. It takes about close to an hour to go through the options, and every prostate cancer is different. There is no way, maybe with some diagnoses, a patient can kind of go online and kind of figure it out. With prostate cancer, there's so many nuances and factors that go into the decision-making process that you really need to find a urologist and a radiation oncologist that you're very comfortable with, so that they can help drill down into the things that are important to you, your cancer, the pathology, the PSA, the exam, and help find the right option for you.
And I'd like to jump right into the middle of a controversy here, because there's a lot of confusion out there. I mean, when you mentioned going online, you can go online and find all the good news or all the bad news you want to find out there. And even American Cancer Society, you know, gets in the middle of it and sometimes provides information that might discourage a man from getting tested, say when they're in their early 40s. And I think oftentimes that's insurance driven, or it's economically driven. You hear horror stories about unnecessary surgeries. So can we just jump right into the middle of that? What do you tell men? How do you navigate that?
Well, you know, I think that, you know, the crux of the matter is that many prostate cancers are slow growing, okay? And we can get away with a period of observation in some patients who are willing to take that risk because many cancers are slow growing. The corollary to that is they're not all slow growing. Cancer, you know, it's estimated that prostate cancer will kill 30,000 men this year. And so I think that's where the controversy comes from. And with each treatment option, there's risk with those treatments. So the personal philosophy of the patient, their risk tolerance as with regard to the cancer versus the treatment, that kind of triangulation is where the controversy comes out of. But it can be very well navigated through with your urologist. This is the kind of conversation that we're used to having every day.
Right. That's great. I think that for a lot of men, you know, any kind of confusion is just another reason not to step into the physician's office. I noticed in my own primary physician's office, half the men there seem to have women, and you know, bringing them into the office to get those tests. I think, you know, you're right that knowledge is power.
Yes.
Otherwise, it's just guesswork. I mean, you're playing the odds. We know that according to CDC in Arizona, each year more than 500 men will die of prostate cancer. It's the second leading cancer a cause of death among men.
Yes.
We know that 1 out of 6 men will receive a diagnosis, and that's not even considering that half the men never go to get the diagnosis. So it's something a man needs to face up to, and I think it's our whole effort here is to demythify. We ask that men go to prostatepledge.com, where you can take the pledge and know your score, and score is sweet. Our hometown baseball team is willing to give you and 10 of your friends a personal suite at a game on June 22nd if you go to prostatepledge.com and take the pledge to get tested. So Dr. Canty and Alexander, thank you very much for joining us here.
Thank you for having us.